and welcome to our Sickle Cell Awareness Webinar. My name is Jennifer Oka, and I'll be your host and moderator for today's impactful section. Today, we are gathered to shine a light on sickle cell disease, a condition that affects millions of lives worldwide, yet remains surrounded by myths, stigma, and silent struggles. Behind every sickle cell warrior smile lies a story of courage, resilience, and unseen battles. And today we are here to listen, learn, and be inspired. This webinar will be featuring a medical professional who would be guiding us, teaching us the things we do not know about sickle cell disorder. And also, we have a sickle cell warrior and advocate joining us this evening, and she'll be sharing her stories as well, her journey so far, how it has been, and what it means or what living with sickle cell disorder really entails. Because a lot of us we just hear SS, sickle cell, and we don't really have deep understanding of what it really means. So, our theme for today's section is breaking the silence, spreading hope and awareness on sickle cell disorder. So, join us this evening. It's a pleasure having you all join us. For everyone that is watching, wherever you are, we really appreciate you all. Thank you for joining us this evening. And we hope you are able to pick one or two things from our section today. So, before we go in, I would like to introduce the sickle cell warrior and advocate that has joined us this evening, Miss Christiana Ijeoma. Ma, please can you say hello to the audience?
Hello, good evening, everyone.
Okay, while we wait for Dr. Kelvin to join us, I would like to hear your perspective of what the sickle cell disorder really is.
Sickle cell is a blood disease that affects the blood and causes a crisis when the blood cannot flow really well through the blood vessels, and this brings about a lot of pain, so much pain that cannot even explain, cannot be explained seriously. So as a sickle cell warrior, I've experienced first-hand pain of what sickle cell is about. And apart from the pain aspect, we also have the infection aspect. Sickle cell causes infection. It also causes organ failures, and also causes a lot of complication. Okay.
Okay, thank you very much for this brief introduction into what sickle cell disorder means. From what you've said, it means anyone living with sickle cell goes through a lot of pain and is prone to several infections because of the disorder. All right. Briefly, I would like you to share your journey of living with sickle cell disease. How has it been since childhood and up until now? How have you been coping? How have you been faring?
My journey has been a very rough one. It has been very, very rough for both me and my family. And seriously, I cannot start explaining all the hospital admissions, all the injections I've taken, and all the blood transfusions I've really taken just to stay alive. And it's really something that cannot be explained. And as a child growing up with sickle cell and with parents that are not very enlightened about it, I really cannot explain how I was able to scale through my childhood as a sickle cell warrior. And I must say that I'm quite fortunate because my parents, they don't really know what it's about. So they keep taking me from one place to another just to look for a solution that they never got. So being with sickle cell has been very rough. It has been very rough for me. And there's also my siblings. There's none of my siblings have the disorder. And I'm the first child among seven siblings. I'm the first child and the only one with the disorder. So I used to think, I used to imagine if I had two or more siblings that has this disorder, how is it going to be? Because one person alone, just me having it is really a whole lot. Then compared to when there's two or more people with disorder. So it's not something that is funny at all. It's not funny at all. Seriously.
That was a very enlightening one. It's really not easy because I can't even imagine what it feels like or what it's like, having to grow up with and live with that kind of pain, and especially with a family that doesn't really know what the sickle cell disorder is. The kind of care that I've been given, it's something one cannot even I can't relate to, but it is well. So I would also like to know how you, like, the first time when you realized what you had is sickle cell. Growing up, like you said, your parents didn't know what it was, and I'm sure you also did not know what it was from the onset. So when you found out, when you understood your condition at first, how did you feel?
Okay, when I learned what sickle cell is about, was I was quite afraid, to be honest. I used to scroll through Facebook and see a lot of comments. I see some people that are no longer available because of this, that are gone because of this disorder. I I see these comments, I see these posts of people that were taken away by sickle cell disorder, and I was quite afraid. I was like, maybe I'll be the next one. Maybe this is going to be what will take me away. But on the long run, I also saw pictures of some people who have lived past beautiful age and are even in their old age, and they are sickle cell warriors. So this is what made me have some kind of faith that I can live past to my youthful age and to my adult age and even to my old age. And as long as I have a good management system, as long as I take care of my body very well, I'm going to live past this age. I'm not going to be taken away by the disorder. So that is what I felt when I first learned about this disorder. When I learned what it was about.
Wow, that's a very good thing. Um, I must commend your courage and your strength and confidence, and by God's grace, because you have this confidence and faith, God will continue to keep you. All right, Dr. Kelvin just joined us. Dr. Kelvin, welcome. It's nice having you join us this evening. Because of our network time and Nigerian factors, I think we should just dive right in. Okay, Dr. Kelvin, we are discussing the sickle cell disorder. The theme of this our webinar is breaking the silence, spreading hope and awareness on sickle cell. Like, as a medical professional, what exactly, when we talk about sickle cell, a lot of people do not know what sickle cell is. What exactly causes sickle cell disease and how does it affect the body? Dr. Kelvin, are you with us? Okay, I think his network, we lost his connection. All right, while we wait for him to join us, Miss Christiana, I would like to know what has been your biggest challenge as a sickle cell warrior.
Okay, my biggest challenge as a warrior, I've been quite ignorant about this disorder. I didn't I didn't think it was that serious. Apart from the episodes of pain crisis, I thought it was just about the pain. I didn't know it comes with the infections and the organ damage, and then the complication. So last 2 years, I got a surgery. I got a hip replacement surgery, and since then it has taken a toll on me. I've not been living the way I used to, like the way I walk around before, and I see myself limping this time. It's been a very big challenge for me, seriously, and it has really kept me inside. I've not been able to go around that much because of this surgery that I'm still healing from.
The surgery was a success, right?
Yes, it was a success, but I'm still healing from it. It's been it's taking time to heal. So that is my challenge right now. It's taking a lot of time to heal. I know it's just a gradual process. It might take a long time, but it's
It will,
definitely healing.
it will definitely heal and you'll go back on your feet like you used to be. The first time I met you, I think that was when we were in school, Federal Polytechnic, to be precise. I actually didn't know it was sickle cell. Yes, and I kept wondering when I eventually found out. I kept wondering how you managed to cope through school. We all know how stressful Copoli was back then. The from main side to the palm side, the hill, the strenuous class schedules and all. Then back to the hostel. The hostel arrangements, it was reflecting back. I keep asking myself, how did you do it? How were you able to manage through those trying times? How did you cope with the pain, the crises, and the stressful moments back then?
Okay, as a student then, the crisis comes quite alright, but like I told you before, I didn't know much about this sickle cell disorder. So I just live like a normal, like every other person. I just decided to live like every other person. But the crisis is what always makes the difference. So as a student that time, I had roommates. I had roommates that were very supportive. And then I also had my dad around. My dad was around that period when I was schooling. So anytime I experience a crisis, a very serious one, he runs back. He comes to school. He comes to school and take me to the hospital. But then it wasn't. I've not had this complication that time. So it was just a normal me. It was me and the crisis. That's just all I was having that period. So although I missed some quizzes. I missed some quiz as a student, but I was able to rewrite those quiz and got my results well. So I think I was quite fortunate as a student. I was fortunate. I did not miss any exam. I did not miss so many other things that are important, like the assignments and all that. So let's just say I was fortunate during my school times. I was fortunate. That was how I was able to graduate.
Honestly, I must commend you're really strong, because personally, I know how stressful Oko was back then. I was well, I was okay, but then the stress was really telling on every one of us. So I can't even imagine how you were able to pull through. But I'm glad you did pull through. What lifestyle choices or habits have helped you live better with sickle cell? Is there anything that you've been doing different since you realized what sickle cell entails that is helping you, cope better with it?
Okay, since I've been able to learn more about sickle cell disorder, I joined a community. I joined many communities of sickle cell online, and I've been learning a lot of things. So I've also learned that I need to always stay hydrated because me normally I don't really take much water before. I don't used to drink water so much, and I think maybe it was also one of the factors that led to the previous many other crises that I didn't know about. So now I've learned to stay hydrated all the time. I stay hydrated, and I've also learned that I need my nutrient, my food. I need protein and more of vegetables so that it will help me with my system. So I've learned to take more of proteinous food and all that so that it will help my system fight. This is some of the lifestyle choices that have been helping me. Hydration especially, and I don't really stress myself that much, especially physically. Physically, I don't stress myself. I don't do things that are very, very hard to avoid getting a crisis.
Okay, guys. So you've heard it. If you know any sickle cell warrior living around you, if you have anyone around you who's a sickle cell warrior, try to communicate with them. Tell them to leave. There are some health, like she has been hydrating, taking more of vegetables and proteinous foods to help with her immunity. I encourage anyone who is a sickle cell warrior around you to do the same. Apparently, if it has been working for her, then it really is working. So, what role has your family and community played in supporting your journey as a sickle cell warrior?
I must say that my family is my number one support system, and I I think if they weren't around, I don't know what would have become of me, seriously. And like, they have been most supportive. They have been most support my siblings, my parents, and in fact, they have been very, very supportive. And some of our neighbors where we used to stay before, we are quite supportive.
So you
So
can say with the
you can
help
say
of your
your
family, friends,
family,
and
friends,
neighbors,
and neighbors.
you've been able to manage you've been able to manage the crisis to a reasonable extent, so it doesn't totally have that effect on you that badly. People living with sickle cell, I've often heard people say a lot of demeaning things to them, some kind of unkind words. Like Nigeria generally, everybody always have something to say whenever they see someone, especially one who is not looking really well. Have you at any point experienced any form of stigma or discrimination because you have the sickle cell disorder at any point? And we would also like to know, if yes, we would like to know how you were able to overcome it.
Well, I'd say that there's no way I've not been able to. There's no way the discrimination will not come, because as I am like this, I'm not so big. Like, I'm very tiny. Like, anytime I come outside or walk past people, they will always look past me. Especially this period I'm limping. But then what I know is that people's snide comment or people's words is not what will define me. I don't really give in to the snide thoughts, the discrimination and all that. And that's why I always make sure to stay on my lane. I don't really get myself involved in anything that will make me to start thinking and looking down on myself. So those things I avoid entirely. I just stay away. And I'll say that I don't know. I'll say that I am the one who always keep to myself. I stay indoors more often. So to avoid any of this form of discrimination. I don't know if you really get what I'm trying to explain here.
Yes,
Yes,
I really understand what you're trying to say, because the world generally, they would always have something to say. They will always have something to, talk about whenever they see someone. Not to think of someone who has the sickle cell disorder. But then, irrespective of what anyone would say, no one actually decides on his or her own or acts that he or she be born with sickle cell disorder. And for that reason, you cannot really handle or do anything. It's not something you can easily influence. It's not something you have control over. Like I do tell people, it's always nice not to make unkind comments to people over issues they cannot control or have influence over. Just like the sickle cell disorder, one do not or cannot even do anything about it. So your looks, your appearance, or anything is not something you have control over. It's just there. And it's really not nice when people are making unkind side comments. So for everyone out there, it is not a nice thing to do. Let's stop the discrimination. Let's stop stigmatizing sickle cell warriors, because it's not easy. They are going through a lot of pain already. And you discriminating or the stigma adds more to it. Their mental health, their emotional health will be affected, and coupled with the kind of pains they experience during their crisis. So it would be nice if we can all try to be kind to people around us, especially the sickle cell warriors. Thank you, Miss Christiana, for that insight. Okay, I would like to know, what keeps you motivated on tough days? Because I'm sure every day is not always good, like especially when the crisis comes. What keeps you motivated? What keeps you okay? Yes, I have to fight to get through this crisis at every point.
To be honest, if a full-blown crisis kicks in, like the one you cannot even explain the pain, I would say that I really lose motivation at those periods. Like, I really lose hope at those periods. But then when it gets better, I see myself having a little hope. And then recently I started making awareness posts, and this post is what also makes me happy. I am very, very happy sharing my story with everyone else, so that more people more people will get to understand what this disease is about, so that they won't be bringing forth children with the disorder, because no one wants to walk through this pain again. I'm already feeling the pain, and I wouldn't want to see more people in it. I wouldn't want to see more children that are in this kind of situation. So making those posts and seeing that people are also understanding me is it gives me the motivation to continue to fight harder in my little way, and make my contribution in little way that I can, and if possible, make a change.
All right. Yeah, that's true. I see more of your posts, and they are quite inspiring. Recently, a lot of people. It was actually I think I forgot that this month was Sickle Cell Awareness Month until I saw your post on it. I had to go back to check, and I realized that yeah, this month is Sickle Cell Awareness Month, and that was when we I started posting on my platform as well. And since I started that posting, I've had a lot of people come to my DM to ask to know more about the sickle cell disorder. So it's a very good thing. Keep it up. God will strengthen you. We are looking forward to seeing more posts from you. Since we are having issues with Dr. Kelvin joining us, there was this question I would have loved to ask him, but I think it's something you can answer as well since he's not here. Like, what does this sickle cell disorder? We know warriors go through a lot of pain. How does it affect? We can't relate. It's something I can't even relate to. But I don't know if there is any way you can explain to us a bit how it affects the body, how you feel when the crisis comes.
Okay, when this crisis kicks in, when I'm in a full blown crisis, I really cannot explain how I feel at that moment because of the pain. But then just imagine that you're being stabbed, like with a knife continuously. The stabbing does not stop. This continues for hours, even days, and you keep fighting this pain. Sometimes these are drugs. Sometimes it does not even work. Sometimes it doesn't work immediately. You have to keep enjoying the pain, and you have you don't have to abuse the drug. So I'll say that the pain is just so unbearable. Seriously, I must say that sickle cell warriors, they are superheroes somehow. I
Sure.
must really commend a lot of them out there. They are strong. They are very strong. They are very, very strong, because this pain is something I can also relate with. Seriously.
Wow. Like I said earlier, the pain is, no matter how much you try to describe it, we can only imagine it, but we cannot feel that pain. And the imagining part alone, it's really a tough one. Trying to imagine being stabbed continuously, the kind of pain you all go through. It's not something anyone should even consider to bring a child into this world to come and go through again. Let's say our parents, out of their ignorance, made the mistake, but then in this age and time, I think it is our responsibility to make sure that this message goes far and wide so that people who are ignorant of this disease would know the kind of trauma or pain they are bringing children into this world to experience. Thank you very
That's the
much
more reason.
for that insight.
That's the more reason why I applaud you, Jennifer, for coming up with this program, because seriously, it's not just easy handling a sickle cell patient. And I think the best thing is just to be visiting places, rural communities, to campaign against the. Both of them are ASAX, and the lady is already pregnant. Normally, I'm not supposed to advise for evacuation, but I have to advise them to go for evacuation. And the lady insists that she will not do it. Now, coming for this kind of a program and coming to hear from somebody who is having this sickle cell anemia, telling you this is what she's passing through, I don't think such person will have the mind to keep the pregnancy. I applaud you for coming up with this program. Thank you very much.
Thank you very much, Dr. Kelvin. It's nice having you here this evening. Thank you for honoring this invitation despite the short notice. Okay, we've been discussing a whole lot prior to you joining and the whole network issue. Well, thank God network is a bit stable now. Because of our time, we would have to hurry up a bit. Dr. Kelvin, at what age can sickle cell be diagnosed, and how important is early diagnosis of sickle cell?
Yeah, at least from 5 to 6 months of age, uh, from 5 to 6 months of age, you can dictate a baby that is having a sickle cell, newborn, and it's very, very important. It's very, very important. Most times, cases that we see now is really single mothers who doesn't know the paternity of their.
While we hold on, we wait for him to join us. For our viewers, I hope you're picking one or two things from what is being said today, and you realize that it's actually not easy. Okay, we have him back. Okay, Dr. Calvin, we can continue.
Yeah, like I was saying, sickle cell disease, depending on, like in our Nigeria here, you cannot dictate it, unlike other developed countries. Sickle cell disease can be dictated from birth, even before birth, but the symptoms appear from 5 to 6 months of age. That's when you will now know that this baby or this child is a sickle cell, have sickle cell anemia from 5 to 6 months.
Okay, the early diagnosis of sickle cell, if it's been diagnosed early, does it help, or is there any form of medication that can be given at that early stage to ease their? I think we lost his connection again. All right, if you're just joining us this evening, we are breaking the silence and spreading hope and awareness on sickle cell disorder. And still with us this evening is a sickle cell warrior and advocate, Miss Christiana Ijeoma. And she has been sharing her story on how she has been living with sickle cell for years, her journey so far, how she has been able to navigate through some of the crises. And we also have a lot of people in our comment section. Miss Christiana Onyekachi Otisilva said, I can only imagine how you'll be feeling when it kicks in. But don't let it weigh you down. Stay strong always. Yes. No matter the pain, we know it is so unbearable. We know we can't even relate to it. But just know that there are a lot of us out here who really cares and who wishes there is something we can do to ease your pain. Please stay strong for us. We love seeing your posts. We love seeing you. We want to always see you strong and smiling. I think we should just proceed with some of the questions that you can answer while he tries to join us again. When you have crisis, are there some crises that can be taken care of at home, or must you have to visit the hospital for anytime the crisis kicks in?
You don't visit the hospital all the time because of a crisis. There are some crises that can be managed at home. Yeah. Like when it starts creeping in, I always notice it and then quickly take my medication or do a hot compress and it will relieve me. But if it persists, then we'll have no choice but to go to the hospital. So not all crises takes you to the hospital. There are some that are mild and can be taken care of at home.
Okay, okay. And
Okay,
there's
okay.
this
And
thing they say.
then this thing they say,
I learned that
I use
the
that
medication for sickle cell disorder are quite expensive and not easily affordable. How true is that?
I've heard of bone marrow transplant and stem cell transplant. They I've learned that it has worked for some people. It has it has cured sickle cell. Although I've not really seen one myself, I've not seen anybody. Yeah, but according to research and according to some people, it can be used to cure sickle cell when they get a donor that can be used for the surgery. But then it's quite expensive and it's not accessible in Nigeria. It must be outside the country, or maybe in the UK and all that. So that is it.
If the cost of curing sickle cell anemia is this expensive, it keeps me wondering why people that are educated and know the consequences of someone with the AS genotype getting married to another AS, if they know the consequences and the financial implications of this thing, it gets me wondering why they still go ahead to make such decisions. Because obviously it is not cheap. The medications, the hospital visits, it's quite expensive and financially draining. In a country like us today, where a lot of over an average Nigerian is struggling, you know, to make ends meet, to eat 3 square meals daily, to take care of basic necessities. And with someone with a salary of 70, 100, 150, 200K monthly basis, now you need to pay rent and other things. Saving money for emergency crisis is a whole lot, which is why we are speaking this evening, which is why we are putting our voices together to tell the world, if one has genotype AS, it is only reasonable that you look for a partner with the AA genotype. Do not bring a child into this world to go through that kind of stress. And the thing is, it's not only the child that gets to experience the pains alone, because when your child is suffering, the parents as well would not be at peace. Because the pain alone, it's not only the child that will bear the pain. If your child is in pain, you're also in pain, because financially, emotionally, mentally, you are also not stable. So it is really not a very good idea for one to overlook all of these things and still decide to go into that marriage. Thank you, Miss Christiana, for joining us this evening. As much as I would have loved Dr. Kelvin to join us, but his network is really not permitting him. So I would be dropping a few highlights on the genotypes, the different kinds of genotypes. We have the AA, we have the AS, we have the ST. Yes, we have the SC. And for these genotypes, when it comes to marriage, the only compatible genotype is either AA and AS or AA and SC. If one has the genotype AS, it will be very wrong for the person to have a partner with the same AS genotype. Like Miss Christina said, in her family, there are 7 children. And of the 7 of them, she's the only one with the SS genotype. When it comes to the number of child that will have this SS genotype, you can't really predict whether it's going to be your first child, the second, the third, or even the last. So any one of the any and in some families there are more than one. I've seen a family that they had about three SS children in that family, and it's quite financially draining, emotionally and mentally. So if you want to get married, please go for your genotype test. In this age and time, there is no reason why anyone would not know his or her genotype in this age and time, because it helps you make better decisions in life. Well, choice of partner also matters a lot. SS is only comes when an AS marries an AS, and there is every 25% chances that they would have a sickle cell child at every point the wife gets pregnant. That means if a woman is pregnant today, there is every chance that there is 25% chance that that pregnancy might be AS, might be SS. That is, if the both couples are AS. That is why we are trying to reach out to you all. Please go and do your genotype test. Do your genotype test. And for those who have someone like me, the experience I had was more like I had a multiple The first test I had was AA, my second test was AA. But the third one was AS. I shared it on my page recently. Now, because of that, I had to go and take another genotype test, making it the fourth time, just to be clear on what my genotype is. So I wouldn't have to make that mistake of being with a partner who is AS. We all know the challenges that comes with being having the AS genotype, but then it is best you make that decision today to be with a partner who is AA. Some people will say, I love her too much or I love him so much. When the whole crisis will kick in, that love might no longer even be there. Miss Christiana, I would like you to shed a little bit of light on this particular aspect. You know, a lot of people, I've heard them say, I love her, I love him. So if we get married, whatever comes, we'll be able to handle it. This sickle cell disorder, is there any effect? Does it have any impact in how your family really is today? Do you think your family would have been a bit different if you did not have the sickle cell disorder?
I don't really know how to explain this particular question, but I'm sure that it's impacted somehow, especially in my life. You know, the rest of my siblings, many of them, in fact, most of them, they don't truly understand me. All they know is that I fall sick sometimes and they will take me to the hospital and they continue to live their normal life. But then, okay, I'll really say that it didn't impact much because they have also been quite supportive. And up till now that I'm still speaking with you, my mom don't understand, don't know what sickle cell is about. She's yet to understand. Apart from my dad already understood it, but not very well. All he knows is that he always check on me and make sure that I take my medicine. I don't think it has so much impact, but it affects me the most actually, because I'm the only one who's different, kind of. I'm the only one with the disorder, so I'm the only one who understand it more. So that is it.
Do you think if they really understanding of what the sickle cell disorder is, they would have do you think they would treat you any different from how it's been now?
Okay, yeah, if they had an understanding of what it is, if they understood it very well, they will take it very very seriously, like as if it's a matter of life and death, and which it is, because this sickle cell disorder have really taken a lot of people. But then they still do not understand the complication aspect. That is why I don't know, I will not blame my parents though, sha. I think I'm also to blame in that aspect, because if I knew better about this sickle cell disorder, maybe I would not develop this complication. Maybe I would be able to search more about it and know what to do to prevent a complication, prevent getting my any of my organs to be damaged and all that. Yeah.
Okay, we have a question from Mary. She said, "Please, ma, I have a question. Will a sickle cell patient continually live on drugs from when the child is diagnosed? Would you like to answer that?"
Okay, sickle cell is a lifetime disorder. It's not something that suddenly goes away. It does not just disappear. No, unless you have this transplant, this stem cells transplant and bone marrow transplant. So as long as you're still living, you're still alive, living with the disorder, you will keep taking your medications. They have the routine drugs. You have to keep taking your folic acid and other prescribed drug by your doctor. So it's a lifelong something. It's not something that you have to stop. It's till the end.
Okay, thank you very much. Okay, there's this thing I've heard sometime that there's a particular age which when one who has the sickle cell disorder gets to, maybe I think 21, 22 or thereabout, that it gets better. The crisis doesn't come as often as it used to, and the person lives more like a more healthy life than at the younger stages. Is that true?
Okay, you know, they have a lot of myths about sickle cell. People just come up with something and say it's like this, it's like that. But that's not actually true. That is not true. Being 21 years does not make it better. Does not make it better. The pain will still come as long as you are still with the disorder. Unless you keep taking care of yourself, managing it, trying to manage it better, that's when the pain crisis can reduce. You make sure you stay away from anything that will trigger any crisis. So age does not really have any effect on it. No.
All right, thank you very much. All right, what advice would you give to young people who are newly diagnosed with the sickle cell disorder?
Okay. According to research, sickle cell is diagnosed earlier, as early as 7 months. So I think it's up to the parents or caregiver of this child to take care of this child better and manage the crisis so that it will not be that much. I think early management reduces so many things, such as this infection that comes with sickle cell and the complication. So if it is diagnosed early, it is better to start following it immediately, so that it will not lead to anything that would damage the organ, or cause any complications in the future. So that is it.
All right. If one is diagnosed early of the sickle cell disorder and with proper medications, proper diet, and staying away from things that might trigger crisis, it will be easier to manage the sickle cell disorder compared to one who is not taking the proper medications and who just lives life like nothing is happening. Thank you very much for that. Okay, we that do not have the disorder, sometimes when we see warriors like you, we get empathic and but we don't know how to help. We might want to care for the person, show love and all that, but we don't really fully understand what you are experiencing and how we can help. So I don't know if there is anything you think that people can do, maybe friends, neighbors, colleagues, and family members, if there is any way they can help to show support to sickle cell warriors, would like to know.
Okay, about that, I think friends and families and well wishers, if the only way they can really help much is to know more about that this disorder, is to know more about it, because at that point in time when a crisis kicks in, I cannot come and start explaining that this is how it's doing me or all that. So I think that is one of the ways to help someone that has a disorder, to know more about that particular yeah, to know more about sickle cell disease, and to be more empathetic, and not to always think that this person wants to likes so much attention and all that, or this person is trying to fake the pain, because sometimes people still think that the pain is not real. People think that it's not real. People think that if you're not crying, like if you're not wailing, then you're not serious. Sometimes we can just keep enduring the pain and holding it in and not shouting, but that does not mean that the pain is not there. So I think it's better to be more empathetic, and to also know much, at least the basic things about this disorder, if one truly want to help somebody that has sickle cell. Thank you.
Okay, thank you very much. Able to understand and support sickle cell warriors, we need to gain more knowledge of what sickle cell disorder entails so that whenever the crisis kicks in, we just be that understanding and really supportive of them at that very point. Before we leave, I don't know, is there any communities? Do you belong to any communities, or do you know any communities where sickle cell warriors can join so they can easily get help. Is there any community like that? Do you belong to? Is there anyone?
Well, it depends on the help you mean. I don't know if you're trying to talk about and knowing more about this other, or help in aspect of maybe checkup and all that. But I only joined online communities of where we learn more about sickle cell and it. I don't actually belong to any other community.
Oh, okay, all right. And lastly, what advice would you give to the general public as regards the sickle cell disorder?
Okay, I really like everyone else to understand what this is, to understand that this is not a child's play. Sickle cell is not just an ordinary, okay, let me not use that word. Sickle cell is not something simple. It's something very complicated, and we have to take it very seriously. And also, sickle cell patients are also human beings. They have dreams, they have aspirations. So we should not discriminate them. We should not talk down or look down on them. They should be treated like every other person. They should be respected. Yeah, they should be respected. Thank you.
All right, thank you very much, Miss Christine. A wonderful time having you joining us. On behalf of the Builder of the Chicago Foundation team, we are deeply grateful for the deep insights that you've shared with us this evening. It's been quite an inspiring and insightful story. Thank you so much. And just like you have been holding on, being strong, we encourage you to be strong and do not allow anything weigh you down. We know, in as much as we cannot fully relate with the kind of pains you go through, but we can try to at least imagine it. And God will continue to be with you. Be strong. We are always looking out for you, be rooting for you, and from time to time we keep checking in to know how you're doing. Thank you so much for your time this evening. It's been a lovely time with you. God bless you so much, and thank you. And to our viewers tonight, thank you so much. It's been a wonderful time with all of you. Thank you for joining us. Thank you for making this event a success. And like everything you've heard tonight regarding sickle cell disorder, would like you to research more on it. And if you haven't done your genotype test, this is a very good opportunity for you to go and do your genotype test. Know your genotype. It will help you in making decisions as regards the person you will spend the rest of your life with. Do not bring children into this world with the sickle cell disorder. It is quite it's a very painful ailment, and quite draining, like they say, financially, emotionally, and mentally. So that is it for tonight. Thank you so much, everyone. Miss Christiana, do you have any last word for us before we say good, call it a night?
Okay. I also want to appreciate everyone that joined this live session, and I also appreciate people who understand this disease and are joining the fight against getting more children with sickle cell disease. I appreciate you, Jennifer Uka, for your efforts. You are really one great somebody I must commend. So thank you so much for this. Thank you so much, Jennifer. Thank you, everyone who understand, who is on this fight against sickle cell disease. Thank you.
All right. Thank you very much, Miss Christina. Do have a lovely